vision's clear, open mind, real conversations we find. Good podcasts, calm and bright, voices flowing day and night. No pressure, just talk, meaningful words when we walk. Each interview feels real, honest thoughts we can feel. Listening is the key in this podcast. You and me. Podcast light and free, stories told clarity. When we speak and truly hear, every voice is welcome here.
Ladies and gentlemen, welcome to God Talk, the podcast where two nurses overshare their hospital stories and somehow make medical talk less scary and slightly more chaotic. This is your host for tonight.
Good evening. I am Carlo Almadal A. Versaga, but if that's a bit of a mouthful, you can just call me Carlo.
And I'm Eliza, and I'm here to make the talk a little bit of chaotic. So today we're going to talk about something big and has a real big impact, right, Carlo?
Yeah.
So it is intussusception.
So, which if you're hearing it for the first time, it sounds like a Harry Potter spell or like a name of a sci-fi film, you know?
Yeah, I agree.
Intussusception. But actually, in all seriousness, intussusception is actually a very serious disease and everyone should be aware of it.
I agree, but medically speaking, it's actually one part of the intestine where they slides to one part, another part rather, right?
Yeah.
Like the telescope.
Yeah. Imagine someone inserting themselves without, uninvited
Yeah,
in your personal space.
Yes, I agree. Like that one person who suddenly like inserts themselves into your life, right?
Eats your snacks,
Ruin your vibe.
and suddenly everything is in chaos. So that basically is what happens in the intestine during intussusception. One part of the bowel pushes into another part and then causing blockage, swelling, and if not treated quickly enough, it could lead into serious problems.
I agree. Yes.
You know, the part that pushes inside is what we call the intussusceptum, and the receiving part is what we call the intussusceptions. It could be a great name for your
Yeah.
future child,
No thanks. My bloodline ends here.
What a waste. I could have been a great uncle.
But joke aside, this condition is actually a most common cause of it is intestinal obstruction. It's in young children.
It's very common in young children.
Yeah, especially between 6 months and 3 years old.
Yeah, exactly. Which is why we invited two amazing guests today.
Oh,
Firstly, we will have Dr. Santos, who is a pediatrician who have cases treated with intussusception.
Hi Carlo and hi Eliza, thank you for having me. I'm so glad.
Yeah, and we also have Anna, a mom of a child who experiences intussusception. Thank you so much for being here and staying with us.
Yes, thank you for inviting me here. I'm so excited but a little bit nervous.
Don't worry, Mia and I are very professional,
Very.
which debatable.
Yeah, I agree. So, Dr. Santos, let's start simple, okay? So, for the parents who are listening to us here that may have never heard about this word before, what exactly is intussusception?
So to answer that question, Miss Eliza, so when it talks about intussusception, it usually happens in a portion of our intestine that folds or telescopes into the next section of it. So when it happens, it does or it can block the passage of the food, and it also reduces the blood flow in that certain part of our intestine.
So basically, the intestine bullies itself, right?
Yes, exactly. And When that happens, when the blood flow is being interrupted or affected, there are certain cases that the tissue can become swollen or damaged.
Oh,
Wow.
I see.
Yeah, that could be bad, right?
Very serious.
So, Dr. Santos, what about the symptoms? What symptoms parents should watch for?
Okay, so for that, one of the most common symptoms or signs is very sudden, like the severe abdominal pain that comes and goes. The child might cry intensely and pull their knees toward their chest. Like it's very, very sudden and very severe.
Yeah, it's like the baby is doing a little dramatic yoga pose, right?
Exactly. And they might have also been experiencing like the vomiting, lethargy, and sometimes the bloody stool with mucus actually, and often described as the current jelly stool.
Wow, that sounds like a fancy dessert, but actually, it's a medical emergency.
Yeah. Actually, Doc, it reminded me of my pediatric patient I mentioned earlier. The kid entered the emergency room and I noticed a sausage shaped on his belly.
Really?
Is that common also for interception?
Actually, that's one of the most common signs and symptoms for a children having
Intussusception.
intussusception.
Ah, okay.
I see.
It would be really hard for the parents to look out for.
And it is very painful and severe for the child to experience that
agree.
kind.
Yeah, that's why the kid is always shouting.
Yes.
But especially for 6 months and
3
3 years old. Yeah.
Yes.
It's common for that age.
Yes, yes.
And here's another interesting fact. Doctors can see intussusception using ultrasound. When they look at the scan, it forms like a pattern called the target sign or the donut sign. These circular images helps the doctors quickly identify the condition and start the treatment immediately. So yes, sometimes medical imaging can look like a target or a donut.
So, hi, Miss Anna. So, how are you today?
I'm good.
So, Miss Anna, can you tell us what happened when your son experienced this?
Yes, my son was about 9 months old, and then he suddenly started crying loudly, and then curling his legs. And then at first we thought it was just gas or colic.
Which is what most parents think, right, Doc?
Yes, it usually does.
So yes, but the crying kept in waves. So and he would calm down, and then suddenly scream.
Wow. So,
Later
okay.
he started vomiting.
That must have been terrifying, Miss Anna.
It was. And then we went to the hospital, and the doctor did the ultrasound, and then that's when they told us it was
Intussusception. Ah.
Here's a cool fact about intussusception. Many people think that intestinal problems should always need surgery, but that's not always true. In some cases, doctors can actually treat intussusception without a surgery. They use a special air or contrast enema that gently push the intestine back into its original position. Think of it like inflating a small balloon to fix the problem from the inside. How amazing is that?
So, in the treatment for interception, it's actually one of the really coolest thing in medicine, you know?
Yes, because you know what, Carlo? Because doctors sometimes can fix it without
surgery.
Yes. So, Doc, can you tell us how intussusception is treated?
So, in the treatment for the intussusception, the first treatment for that usually is an air or contrast enema. When we say that kind of treatment, it is actually to push back the intestine to its normal or original position.
So, it's like basically a medical reverse Uno, right? Doc?
Exactly, Carlo. And it so works in many cases. And if it doesn't work, that's the time that the surgery is badly needed.
So we really just hope that air or contrast enema should really work, because surgery is very risky, especially for a
agree.
child.
Yes.
You're still young, right?
Yeah.
So, Miss Hannah, can you tell us how was your son treated?
They use the air enema procedure, and then thankfully it's worked, and then my son is recovered quickly.
Yeah, that was actually amazing that the air and contrast enema works for your child and no need for surgery. That must have been such a relief.
Yes.
Thank you.
So, Carlo, for the exciting part of this podcast, so let's have a quick quiz for
Oh
you.
no, is this part of the podcast, a quiz? Oh
Yeah.
no, I don't like where this is going, but so I guess it's for the viewers' turn to answer the quiz.
I
To
agree.
test if they
Yeah.
actually are listening
Listening,
to
yeah.
our podcast.
So, here's our question.
Mm.
So, to all our viewers, so what is the commonly affected age group for this condition?
So the answer is, I hope you have the same answer as me. So the answer is children between 6 months to 3 years old.
I agree. Correct, Carlo.
Yeah, thank you so much. For once, I am a competent nurse, right now?
Actually, you're doing great.
Thank you. So now we are on the closing part of our podcast.
Yes.
Sadly, we have to end, but it's a happy ending, I
I
guess.
agree. So for the big takeaway in this lesson or topic that we have today, again, Carlo, is that intussusception rather
Intussusception.
is, yes, I'm so sorry, it's so hard to pronounce, right?
Yeah.
Again, intussusception is a serious condition, but it's treatable, especially when it detect early, right?
Yeah. If a child has a sudden severe abdominal pain, repeated crying episodes, vomiting, or any unusual stool, and a sausage-shaped lump on his belly, I think it's time to seek medical care
I
immediately.
agree, yes. So again, to our guest,
Yeah.
Miss Anna, thank you for sharing your experience with us.
Thank you for having me here.
Yeah, and Dr. Santos for helping us being medically accurate while also make questionable jokes.
Thank you, and it's also my pleasure.
Okay, that's it for today for our episode of The God Talk. So remember,
If someone suddenly inserts themselves where they shouldn't,
whether in your life or in your intestine,
it's probably a problem.
okay, so see you on the next episode.
Goodbye.
Bye!